Let's now focus on doctors' strike, and Kenyan doctors are elated by the news that the national government has agreed to have them paid for the 100 days they did not work as they were on strike. But the Council of Governors Chairman Peter Munya says there is no way the county governments would agree to pay for work not done. KTN's Carol Nderi reports.
Though the doctors have hailed President Uhuru Kenyatta's advice to governors to pay doctors for the 100 days they were on strike, they are keen to have public health facilities stocked with adequate drugs and facilities, one of the key cornerstones highlighted in the collective bargaining agreement. Speaking in Nyeri at the Nyeri County Referral Hospital, officials of the Kenya Medical Practitioners and Dentists Union, KMPDU, maintained it was unfortunate that the interruption of commodity supply in hospitals was affecting service delivery.
I just wish to sincerely thank the President for his expression of goodwill and good faith. Therefore, which means that the doctors in the whole country and the general public are advised to keep calm. There will be no interruption of services in hospitals following, of course, this directive, and hoping that the directive will be followed.
I'd like to take this honor to thank the President of this country for hearing the plea of doctors and ending this ceaseless tug of war that is purposeless and energy sapping by asking the governors to pay the doctors. We are grateful. Thank you very much. He's a leader that knows the way, goes the way, and shows the way. Thank you, Your Excellency.
We alipeana directive turudi kazi, tukatimu hiyo amri yake, na pia yeye akasema ya kwamba tusahau yale yalikuwa yamefanyika, kwa sababu watu wakiwa mgomo kuna yale mambo watu wanasema, wakiwa pale kwa nje wanakuwa wamekasirikiana kidogo, lakini tusameheane. Na Wakenya pia mtuelewe, tulikuwa pale tukizungumzia kuhakikisha kwamba sekta ya afya inapata kunawiri katika hii nchi yetu.
However, the chairman of the Council of Governors, Peter Munya, seems not to be in agreement. In his view, doctors should not be paid for services they did not render while on strike.
Ule ya kwamba kama hujafanya kazi utalipwa na nani? Mimi sitaenda huko Senate kujibu maswali ya vile nilipo mtu ambaye hakufanya kazi. Hiyo ndio msimamo ya Council of Governors, si msimamo wa Munya. Council of Governors hawajakutana kuongea kubadilisha hiyo msimamo. Kwa hiyo hiyo msimamo ni hiyo ya kwamba mtu atalipwa yule amefanya kazi.
The County Executive Committee member in charge of health, Nyeri, Dr. Charles Githenji, told KT News on phone that Nyeri would consider paying the doctors as long as it was part of the return to work formula signed between the doctors and the county. Dr. Githenji said that under normal circumstances, the county would not pay for work not done, and to do so would set a bad precedent. However, for the sake of peace, and as long as there was a clear understanding between the doctors and the county on why they are being paid, then the county would make arrangements to pay them. The doctors are demanding for better working conditions.
When you are sent out at 4 a.m. in the night, you will find nowhere to buy drugs. Sometimes those drugs just cost 40 shillings. So we are also urging every single manager of public facilities in this country also to ensure that there is no interruption of supplies and that all facilities are well equipped so that doctors can work well. Doctors are now having great morale. They will work very well, but they cannot work well if there are no facilities. And we want our patients to get the best services ever.
Carol Nderi, KT News, Nyeri County.